I wanted to introduce you all to Ryan Johnson, who is the Legislative and Policy Lead for in the Division of Economic Assistance and Employment within the Department of Human Services. And where are you, Ryan? Here you are.
I'm here.
Excellent.
All right, thanks, Wendy. I appreciate the introduction. I appreciate the time. I know we're running short on time, so I'll run through this fairly quickly, but I just wanted to provide a little bit of context before I get into the meat of the presentation. So the information that I'm sharing today is based on a review of our state statute, as well as federal regulations, as well as guidance that we've received from the U.S. Department of Agriculture that administers the Supplemental Nutrition Assistance Program, or SNAP, or formerly known as food stamps. And I'll just say before I kind of get into what's on the slide here in front of you, that for many public assistance programs, all the public assistance programs listed here on this slide, we kind of think about income in two broad categories. So one is earned income, so basically income that people receive through work or employment. And then the other source of income is really defined as unearned income, and that really is about income that people receive without it being received as not being required to receive that income, from like performing any kind of labor or service as a condition of receiving the income. And so an example of something that's like unearned income would be like a disability payment or something along those lines. So as we think about guaranteed income payments, the first thing we had to do at the state was really decide kind of which category these fall into, and really do fall into that unearned income category. Since, as Casey mentioned, people are receiving these not for any specific, not for any labor or service or any kind of employment that they're participating in. It's just a payment that they're receiving through a program. So it's really defined as unearned income for these public assistance programs. But since it's a relatively new source of income that hasn't really been kind of when these programs were conceived or when the state statute was written, there wasn't something that they put into state statute to really say exactly how to treat guaranteed income payments. And so there was some time that we needed to spend to really review the statute and consult with others, both our state and federal partners, to really get a better sense of how these payments should be treated going forward. So I guess what I'm going to share here today is just some guidance about how these guaranteed income payments are treated specifically for the programs listed here. So child care assistance, our diversionary work program and Minnesota Family Investment Program, which are our cash assistance programs for families with children, our refugee cash assistance program, and then a few other programs, including general assistance, Minnesota Supplemental Aid, housing support, and as I mentioned earlier, the Supplemental Nutrition Assistance Program, or SNAP, or food stamp program. And I just want to say from the outset is that we are working to finalize this guidance internally at DHS, and it has not been formally issued to counties and tribal nations quite yet. It will go out hopefully in December and January. And so we'll be also working with them to give them a heads up about this. But I just wanted to let folks know that once that guidance goes out, we can share it with the group here as well. But just to know that this is kind of information that we're still working to develop. We have a decision, we just need to get the guidance issued in a formal way. So I just want to let people know that it's not formally issued, but it's coming. So if you want to go to the next slide. So I'll start with these four programs. These are programs that we administer in the division where I work. Or I guess not child care assistance, but diversionary work program, the Minnesota Family Investment Program, and the Refugee Cash Assistance programs are all in the Economic Assistance Employment Sports Division, and then Child Care Assistance is in the Child Care area at DHS. So all these programs, in addition to the programs on the next slide, all fall under one section of statute in Minnesota. And basically, after we reviewed that statute and looked at what was counted as unearned income, it really became clear that guaranteed income payments do not fall into that definition of unearned income and do not count when determining eligibility or benefits. So that again applies to all those programs that were on that previous slide, as well as the three programs listed here: general assistance, Minnesota Supplemental Aid, and housing support. So that's the guidance that we'll be issuing to counties and tribal nations, is just to say for any of these programs that fall under this specific set of statute, that these guaranteed income payments do not count when determining eligibility or benefits. So I think that's some clarity that maybe we hadn't provided before, and hopefully will be good news for those folks, for those of you that are administering these pilots and are really had questions about how these payments would impact people's benefits. So you want to go to the next slide, and I can talk about SNAP. So the Supplemental Nutrition Assistance Program, or SNAP, or food stamp program, is a little bit different because this is a program that is really regulated at the federal level, and then each state supervises and administers. And of course, in Minnesota, we have county-based administration. But the guidance that we really received from SNAP is a little bit different than the previous program. So basically, payments from guaranteed income programs do not count when determining eligibility or benefits for SNAP if the payments are sourced solely from private funds or a mix of private and public funds. So I think, as Casey mentioned earlier, I think all the payments that were coming out of the St. Paul program were a mix of private and public funds, so therefore would not count for SNAP. And one of the reasons that this is, and I'll just say also payments, if it's payments funded solely from public sources, so either state, local, or federal dollars, or a mix of those public funds, then they cannot be excluded for SNAP. And the reason why this is there's in federal regulations allow states to exclude income sources that the state's TANF program is excluding. And in Minnesota, our TANF program is the Minnesota Family Investment Program. But there is an exception to that. There's something that in federal law that says that regular payments from a government source cannot be excluded for SNAP, even if they're excluded for the TANF program in the state. So that's why the federal government has basically said that these guaranteed income payments can be excluded for SNAP if they include private funds, so either solely private funded or a mix of public and private funds. So that's a little bit different for SNAP, but I just wanted folks to be aware of that as well. And if you want to go to the next slide. So two pieces of information about healthcare programs, and this is, I'm really out of my depth here, but I will just share this because I know the folks from our healthcare area have reviewed this, and this is the information they provided. So there's two different programs in Minnesota: medical assistance for families with children and adults, as well as Minnesota Care. And I know Casey referred to this as well, but those two programs, DHS is working to determine if these guaranteed income payments are considered non-taxable, due to being either general welfare payments or disaster relief payments. And that determination has not yet been made, but if the income is considered taxable, then it must be counted when determining eligibility for those two healthcare programs. If it's determined that those payments are not taxable income, then the income from these guaranteed income programs would not be counted for those two healthcare programs. There is one healthcare program that's administered slightly differently based on state law, and that's medical assistance for people who are age 65 or older, people who are blind, or people who have a disability. And currently, based on state statute, the payments from guaranteed income programs would count when determining eligibility for that healthcare program. And in order to change that, there would need to be state legislation that would be put into state law to say that these payments would be excluded specifically for that healthcare program. So I know I went through that all very quickly. So I just want to pause here and let me just check and see if there's any, I guess people can either unmute themselves to ask any questions, or feel free to put any questions in the chat as well.